Hi, my name is Maria Weeks. I'm giving you an informative speech about Florence Nightingale. My class is Introduction to Speech. I have here my outline for Florence Nightingale, and this is my reference page for my information, my sources that I've gotten. This is my audience.
Hello. Hello.
Hello.
And we're gonna go ahead and get started. The question to starting my speech is, can one woman lay the foundation of professional nursing? So I'm gonna talk about who Florence Nightingale was, her role in nursing, and her impact on the nursing foundation. Florence Nightingale, as stated by Kiera Stevenson, in the early years of Florence Nightingale, I'm going to show you her picture. This is Florence Nightingale. And in her early years, Florence Nightingale was born into a wealthy family and active in the life of a class of the English society. She was raised in a culture that abided by Victorian codes of conduct with strict guidelines for the role of women in society. She wanted to also, when she was a little girl and she took care of her dolls, when they would fall apart, she would bandage up their arms, according to Kiera Stevenson, and that's what got her interest in nursing, wanting to take care of people. Her family was against that because they wanted her to be a woman of leisure. They wanted her to be a part of the high society life, but she wanted more than that. She wanted to be able to take care of people. She went off to school where it's at the time it was the hospital, and it was where she worked at is St. Thomas Hospital in England, is where she started working at. She started going to school at first though in Germany. I don't got the name of that at this time, but I do have the picture of the hospital where she first started to work, where when she started to work there in the hospital, they liked her work so much that they moved her up as a superintendent on the hospital floor. During that time when they promoted her, she had to face the cholera virus that was going around, and her promotion was basically to do more of cleanliness for patient cares. At the time, doctors were taking care of the patients and going from patient to patient and not washing in between patients. And it was a high death rate of about 42% death rate in the hospital. When Florence Nightingale came, she saw the high rate of the death rate, so she started cleaning up after each patient, and she reduced the rate from 42% to 2% in the hospital. Seeing that also, during the time of according to Michael D. Calabria, Florence Nightingale led a team of nurses to the war-torn Crimea in 1854. She revolutionized the field of nursing and forever transformed military and public health care in Europe. I'm going to show you a picture of where she did her work at in Crimea. She would take care of wounded soldiers and dying soldiers out there in the war. They called Florence Nightingale for help because there were a shortage of nurses. So she got 43 nurses to go with her overseas to help take care of the wounded soldiers. And Florence Nightingale even wrote a book called Nurse's Notes. And she was, according to, Florence Nightingale herself, she had written Observation of the Sick. The most important practical lesson that can be given to nurse is to teach them what to observe and how to observe and what symptoms indicate improvements. She didn't want, according to Florence Nightingale's notes, she said it wasn't good enough to ask the patient, are you feeling better yet? It was actually to see signs and symptoms of improvement. So she was looking for like signs of infections of fevers, or if they were being nausea, vomiting. She was looking for all those signs. Just asking the patient if they're feeling better yet wasn't good enough. So she went into more detail of writing down basically notes of how to take care of a patient, changing bandages, and how to assess them, and overall nursing care. The last thing that I thought it was really nice to know about Florence Nightingale was, according to the Red Cross societies in London, they created a commemorative International Nightingale Medal to be awarded to those distinguished in the nursing field in honor of her contributions to the nursing field. So in the nursing field, that is the highest medal to get in the nursing field, is the Florence Nightingale Medal. And that's it. Thank you.